Hi, everybody. My name is Robert, and I am on day one of recovery from surgery from my slap tear. And you can see my puppies in the back. That's Ozzy yawning. They've been keeping me good company, as has my partner Roger. Um, I wanted to record a short video. Hopefully, this won't be super long because my good arm is tired. You can see I've got my sling on right here. There's my surgical site. It's real puffy with the bandage, which is good because that means that uh, it's well protected. But on the other hand, it's kind of bad because ice and cold has a hard time getting to it. I wasn't lucky enough to have one of those fancy ice machines. Um, but I just wanted to talk really briefly about the whole experience. The reason I'm doing this video is because in the lead up toward my surgery, I sought out videos on YouTube that talked about slap tears. And specifically, like I wanted to see the procedure itself so that I was aware of like the various approaches and the various techniques that would be used to fix it. But more importantly, I wanted to make certain that I had a at least decent understanding of what to expect from the immediate aftermath and the recovery process. And so there have been a ton of great folks out there who have uploaded their videos and shared their experiences. And so I feel like it's only fair that I contribute a little bit to that. So I went, I was at the surgical center for 5 a.m. Thankfully, Roger was with me. I certainly couldn't have made it without him. Um, my throat is still scratchy. So if I'm like weird with like swallowing and whatever, that's because of the breathing tube. It's not terrible. It's just uncomfortable. So like, don't be freaked out by that. Um, so you can see a tree back there. I'm in South Louisiana. I live in Baton Rouge, and this is the remnants of our Mardi Gras tree. So don't think we're weird. Um, but anyway, uh, okay. So we got there at 5, and it took a while to get the registration process done. Of course, I'd done all the pre-op and whatnot, but then I once they got me going, I was the first case of the day, thank goodness, and that was great. It was a big help because it meant that I could get it over and done with. All of the staff was super nice, which I appreciated. They answered all my questions. I didn't really have many at that point, um, but so they gave me the anti. I mean, it's not like anti-anxiety medicine, I suppose, but it's something to help me relax. So I guess sort of. And they wheeled me back to the operating suite. And uh, once I was back there, they started kind of doing their thing. I was still on the gurney. They had me scooch over to this other thing, but I barely remember that, to be honest. And they got going. So once that happened, I don't remember anything. I guess I was imagining that there would be more of a moment when they say like count backwards from 10 or whatever. They didn't do that, and that's okay. It's not a big deal. So when I woke up, I wasn't actually feeling bad. I was groggy, of course, and still trying to figure out what the hell was going on. But then they asked me about my pain level, which was good, and I was hurting. And at first, I was like, I'm fine. But then after I kind of became more alert, then it was like, oh, well, I mean, if you have something to give me, then let's go ahead and do that. So they ultimately gave me 2 shots of what I imagined to be a small dose of fentanyl. So that was really helpful. And that kind of got me able to transition from the recovery area to the room where I was staying so that they could kind of watch me over the course of the immediate post-op process. Now, bearing in mind that when you receive that pain medication at that phase, at least here, um, they have to watch you for a specific period of time after each administration. So now that I'm kind of talking like this, I do want to mention, obviously I am not a doctor, and so please obviously defer to your own medical personnel. I'm not a doctor. This is not medical advice, whatever. But this is what happened to me. So I want to kind of hit on some high points real quick in terms of things to look out for. The nerve block. I got a nerve block for my arm, and it was awesome. And it was weird because my hand was so floppy. And once I was discharged and I was sent home, Roger got me situated in my recliner. I hope you have a recliner. Poor thing. If you're undergoing this procedure, you need one, or at least a space where you can simulate a recliner. I've heard about wedge pillows and that sort of deal. I can't really lean back that far. It just seems to hurt. But anyway, back to the nerve block. On YouTube, there are lots of videos where folks like major athletes and MMA fighters talk about, make sure that you stay on top of your pain meds in advance of the nerve block wearing off. I cannot stress that enough because I was trying to be real strict, keeping in mind what they said, but it just so happened to coincide with the time frame. Sorry if I'm moving a lot. I'm having to use my phone. But it happened to coincide with the time frame of when my dose was supposed to take place of pain medicine. I did not take it soon enough. And going from a completely floppy arm to suddenly feeling all the sensations of the surgical procedure was not an enjoyable experience. I do not recommend it. So, clearly be mindful of your dosages and your time frame in terms of your pain medicine, but do remember that it takes a while for the pain medicine to kick in. So, at this point, I'm gonna, just because I'm literally 24 hours out from the pain block, I'm gonna start taking my pain medicine just 1 hour sooner. And then kind of once I get ahead of the curve a little bit, then I'll be more strict again about taking it every 6 hours until I don't need it anymore, or until ibuprofen or whatever NSAID that maybe you have available takes effect and helps you to manage. So one thing that I do want to mention is that it's weird, the subtle movements that we do on a daily basis that I would have never imagined involved shoulder movements or upper arm movements, like leaning forward. So when I get into the chair, like leaning forward to get out of it, that junk hurts. So just be thoughtful about how you do it. My dog is coughing. Yikes. Whatever. This will be entertaining and hopefully informative. I'm obviously still on my medicine, so if this is a little bit less coherent than I would normally like to be, we're going to go ahead and blame it on that. Other things, like I mentioned before, the thickness of my surgical bandage, I had my shirt over that with a nerve block, and so like ice just didn't really get to it, so that hasn't really been helpful. What else? I mentioned the throat thing from the breathing tube. Okay, so now that I'm looking at myself on screen, one idea would be, for me at least, because I don't care, like whatever, I'm not here for glamour. I went ahead and shaved my head. I do not need to fool with having to brush my hair. Obviously for, some ladies or whatever, that might be a thing, but for me, let's get rid of that. And then I had like a bushy beard, but now I'm rocking the scruff pre-op. But with that said, don't like I just trimmed it. I didn't shave because they don't want you to use fragrance type things immediately prior. So let's see, what was it? About a week before surgery, actually, I just went ahead and got rid of all that, so that I have less to worry with. Okay, what else so far? Like I said, it's day one. I didn't sleep very well, and that's I suppose to be expected. Once the medicine gets really in your system, or in my system at least, I slept pretty decent for a brief period of time, and then other than that, it's not been the best. Uh, I had an appetite sooner than I expected that I would. Um, my sweetheart made us some pizza, and so I ate two good slices of that. That was great because I was wicked hungry. Um, and that's really kind of it for now. Things that I'm anticipating now that the nerve block situation has worn off. I feel like I can get more into the swing of what this overall recovery is going to be more like. And so, as funny as it is, and shout out to the person in the YouTube video who mentioned this, um, I'm a little worried about having a bowel movement, taking a big dump, because I did not practice wiping my butt with my left hand. And as much as Roger loves me, that's not a thing that he's going to assist with unless I absolutely need it. And so I'm a little nervous about how that process is going to go. But many of the people that I did see recommended things like wet wipes, flushable baby wipes, stuff like that, which I'm sure would be very helpful. Uh, what else? I don't know. I'm still very much medicated. Overall, the surgery was nowhere near as scary as I thought it would be. Thankfully, in the case of my slap tear, it wasn't as serious as they thought it would be. I thought I was going to have biceps tenodesis, but that didn't end up being the case. But they don't really know, or at least in my case, they didn't know until they got in there what to expect. So they kind of prepared me for all the eventualities or the different alternatives, which I appreciated. But thankfully they didn't have to fool with all that. So, okay, guys, I may do another video later once I've conquered the BM situation. Hopefully I can offer some constructive and helpful advice on how to deal with that. Because, it's the little things. Speaking of little things, when it comes to like how to do stuff, my medicine, I can't reach. Damn it. I just tried to reach with my arm. Most medicine bottles have the child lock caps, which is great. Obviously, base this on your individual situation and whether or not you need to ensure that, no kids can get into your medicine or whatever. But we don't have kids at the house, so I was able to turn my medicine bottles upside down so that I could put my medicine bottle in between my knees, twist with my good hand to open it. So there are little tricks and things like that that are going to be very helpful to you. All right, well, this video has gone on much longer than I anticipated, and it is right at time for me to take my next dose of pain medicine. So I'm going to sign off for now, but if you have any questions, please feel free to leave a comment below. Feel free to subscribe if you'd like. I'll be posting some more videos throughout the process. And I hope that your surgery goes as planned. I hope that you do well. And thanks so much for tuning in. Thanks.